Hello, I'm Dr. Graham, the back pain professor, and welcome to the second part of stenosis. And what we're going to talk about these next few minutes are common treatments. A lot of my patients that come in, they tell me they're taking non-steroidal anti-inflammatories, better known as ibuprofen, naproxen, stuff like that. I would strongly advise you to go to a video we have in the same section under ibuprofen, non-steroidal anti-inflammatories, to look and see the problems that taking too much of this stuff can cause. Another treatment that people take are going to be prescription drugs, and that's going to be opioids. You've probably heard of these: Oxycontin, Percocets, things like that. And then these kind of drugs, hydrocodone. The problem with these things are that they contain substances related to codeine. It can be habit forming. They can be addictive. Most of my patients that have come in here have told me they've tried over-the-counter medicines, they've tried prescription pills, and many of them have gone into steroid injections. And these things, what they do, the doctor, the pain management doctor injects a corticosteroid into the space, and that helps reduce the inflammation. He's getting right into that one spot to try to get a lot of inflammation out of there. The problem is repeated injections can weaken the nearby bones and the connective tissue. So really, they only allow a few a year. It's not uncommon that patients have come in and they've had surgery for stenosis. And I want to talk to you about what this Mayo Clinic website talked about. But mainly their goal with this stuff is to cut away bone and to make more space for the nerve. That's a good illustration. There's the surgery done. They basically they do this fusion to maintain the strength of the spine so this thing doesn't collapse. Some people's symptoms stay the same, and some actually can get worse after surgery. So some people probably do get some better. Some people probably don't change a lot, and there's enough people getting worse that they put this on the website to give a warning out. There's risks involved with surgery. It includes infection, a tear in the membrane that covers the spinal cord, blood clots, and neurological deterioration. I've been in this healthcare field long enough to see that there's been a lot of stuff that can go wrong with back surgery. So you really have to weigh the risks of the pain versus the risks of the surgery. Now, the method that we use here is we use a computerized adjusting instrument. I really like this instrument. This instrument actually gets in there and separates the spine, makes more space for the nerve, and that's what's going to help with people's pains. We've really helped a lot of people that have this stenosis problem. They have the pain down their legs and their back pain. And this instrument we use is noticeably better than when I use my hands. We're just getting a ton of people better with this, using this type of instrument. I like it because it's much more precise than I can get with my hands, which is one reason I think that we've had better success. But it's also very painless. A lot of people are concerned about, is it going to hurt and all that? And I can tell you this instrument is painless. And it's also safe. This is, our instrument is actually certified by both Underwriters Lab and the FDA. I'm Dr. Graham, the back pain professor.